thank you for taking the time to just chat with me today. I do want to say, like, I know that you follow me on social media, but I initially saw you on social media on like another nonprofit site, and I was like, wait, this is a Black woman neurologist? Like, they exist? Like, I just went down this huge rabbit hole. And so just to see a Black woman that's a neurologist, a neuroscientist, an
Oh,
advocate, and truly like fusing both like the practice, the medicine, the science, and the teaching, and you were amplifying dementia, just like truly made my heart smile.
oh, thank you. Thank you. I appreciate it. Thank you so very much. And I too follow your social media and I just respect the work that you do. You're providing information for caregivers. You're being vulnerable. You're sharing your journey. So I just respect that work. And I'm glad that we get to come together through HFC to talk about dementia and the work that we do together.
Awesome. Okay, so I'm going to kick off with just some human introductions because we're recording and I want to know more about you. Oftentimes in interviews, people, read off the bios, and obviously the whole website, bio, LinkedIn is excellent, but I want to hear from you. What would you say are the top 5 things that you are most proud of in your professional, personal life and career that you want for us to know?
Oh, I love it. I love that question. I think the one of the biggest things is being the first African American female to graduate with her medical degree and doctoral degree at the University of Kentucky. And throughout my training, I've been the only one in a lot of rooms, like the only Black medical student, the only Black scientist, the only, MD, PhD, stroke neurologist, and giving a voice for people that look like me in the Black community. So I would say that's my number one accomplishment that I'm proud of. There's several others. I think a number two accomplishment is that, and being in these spaces and being in these rooms, I don't want to be the last one. So
Mm,
I'm all about like reaching out, reaching back, mentorship. So through my nonprofit that I started, Zigbay, and I'm still up and running, but the one of the goals of that nonprofit is to increase, recruit, retain a more diverse cohort of neurologists, healthcare providers, neuroscientists, and health professionals. And so with that group, that's where I help mentor people that look like me from all across the world. So that's another accomplishment I'm proud of. Second, is so now I'm currently a stroke fellow physician. So what that means, I just finished my residency program at Mayo Clinic, and so now I'm at Grady Hospital, Emory University Hospital, doing my stroke fellowship. So I'm also proud of that accomplishment as well. Those would be the accomplishments that I'm the most proud of. And just another accomplishment is growing up. I was always great at science, always great at medicine. So those are the things I focused on. But I think in graduate school, I had a mentor when I was giving my presentation about vascular dementia. And in one of the studies, I said, okay, I wanted to study African Americans and use this as part of my statistics. And she really grilled me in a great way about, well, why did you decide to use that group, that population? Do you understand the context and the background of Black individuals in research and care and medicine? And I said, no, I do not. So she gave me a good lecture on it, and then she gave me great books to read. And from that question, that's how I dived into advocacy work and health disparities in dementia and in neurology.